Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery, and all I do is perform aesthetic or cosmetic surgery. I've been doing that in the Scottsdale Paradise Valley area since 1992. You know, I'm very excited about this procedure that I've come up with called a GenXLift. I'm so excited. I've trademarked it, and I am doing a lot of them because I think it meets a specific population's needs. So people always ask me, Dr. Shapiro, who is the ideal candidate for GenXLift? And I think the ideal candidate is those patients that fall between the ages of the early 30s and mid-50s. Those are the GenXers. These are patients that have all the signs of and symptoms of sun damage and aging, especially that we see here in Arizona, and want some treatment but may not be interested in having a full facial rejuvenation or having something that costs as much as a full facial rejuvenation or have some kind of recovery involved with that. So a perfect candidate for a GenXLift is somebody, as I said, in the early 30s to mid-50s who may have lost some volume in their face. That is a common occurrence as we age. We tend to lose some of the fat in our face. We start to see some hollowing beneath our eyes. We start to see some hollowing in our cheeks, and it just makes us look gaunt and older. So for those patients, I will go ahead and inject some of your own fat. That can be done in the office and basically do a 4-day laser peel to help the skin texture, to even out your pigmentation, and to overall complement that fat transfer. You know, again, the ideal candidate for the GenXLift wants to avoid going to the operating room to have these procedures done because this can be done in the office. Also, as we advance the signs of aging, the ideal candidate, again, tends to be a little bit older than the first stage. Now we're talking about the second stage that has a little bit more advanced signs of volume loss and may have some neck laxity. Again, not too much neck laxity because that patient would need more involved surgical procedures to tighten up the neck. So in those patients, as we advance to the older patient that have more advanced signs of aging, but still not a lot of aging in the neck, they're wonderful candidates for the GenXLift. So that would be somebody in their mid-40s to early 50s, mid-50s that has cheek laxity, some jowl formation, along with nasolabial folds that may seem to be prominent, hollowing of the lower eyes, skin changes, and feel that they want to look more youthful. So that patient would be a great candidate, especially if they want to avoid going to the operating room. They want to avoid a prolonged recovery. You know, after a GenXLift, generally you're back in the saddle after about 7 or 10 days, and it tends to be less expensive than going to the operating room and having the full facial rejuvenation. So the ideal candidate really depends upon what you're looking for, but the best way to find out if you're a candidate for a GenXLift, come into the office, get a consultation, tell me what your expectations are, tell me what you're looking for, and we'll go over what your options are. Thank you.